Hi, everyone. Thank you for joining our webinar today. We're going to get started now. We'll be going over how to reoccupy your building during the COVID-19 pandemic, introducing risk management approaches, what kind of things you have to worry about in our current context, and what kind of things you need to consider as you're making your plans to bring your employees and your customers back into your businesses safely. Or if you've already done that to a small degree, how to expand that to make sure that you can keep your risk management practices in place and keeping everyone safe. So today I'm going to introduce our panelists and go over a couple housekeeping issues first. First, I'll introduce myself. I'm Deborah Meads. I work with our occupational health and safety group here at Pinchin in our Northeastern Ontario region. So I range from Thunder Bay down to Ottawa with the occupational health and safety work we do. We have a panelist of our local Pinchin experts as well as experts from Algoma Public Health today. So from Algoma Public Health, we have Jennifer Flood, who is a public health nurse at the Algoma Public Health Unit. Jennifer is an RN who has worked with the Community Wellness Program with Algoma Public Health for 11 years. Her current areas of focus are healthy environments, active living, and on and off road safety. Jennifer received her Master's of Nursing in 2015 and also works part-time as a professional in the Bachelor of Nursing programs at Sioux College and Nipissing University. She was a member of the Board of Registered Nurses Association of Ontario from 2015 to 2019, and currently is the Treasurer and Secretary of the Ontario Nurses Association Local 012. We also have Michael Park, who is a public health inspector with the Algoma Public Health Unit, and some of you might have actually worked with him personally as well. So Mike is a public health inspector with the Environmental Health Program at APH. Mike has worked with APH for 2 years and previously worked as an inspector in Huron County. He's the lead of the Food Health Safety Program at APH, and he teaches food safety in the community in that role through campaigns and food safety classes. And throughout the pandemic, Mike's role has shifted slightly to encompass sharing what businesses and members of the public can do to prevent the spread of COVID-19. From Pinchin, we have our National Practice Leader in Indoor Environmental Quality, David Muse. David is as the national practice leader, focuses on the technical performance of the IEQ team to ensure consistent, responsive, and superior service in every region in the country. He has over 25 years of experience in indoor environmental quality and occupational health and safety, including working in hygiene and mold with the mold remediation as well as mold assessment for health impacts. This experience extends to commercial, institutional, healthcare, educational, government, public, and private, as well as construction sectors. And Stephen Booth is with us today. Stephen is a director of the Indoor Environmental Quality and Occupational Health and Safety Practices in Pinchin across the country. So Stephen, looks after IEQ and OHS nationally with Pinchin. He has over 20 years of infection control and indoor air quality consulting experience. He has a diploma of architectural technology and has developed standards for mold assessment and remediation, as well as indoor air quality in Ontario through his work with the Environmental Abatement Council of Ontario. So that is our group of panelists today, and I'll just go over a couple housekeeping issues. We want to make sure that everyone has everything working properly with their display for the webinar. So if you don't have correct audio or video working, we'll just send out a little message as well to you as well, in case you can't hear. But use the raise your hand function in the the webinar platform to call attention to any technical issues you're having, and we will get those resolved. Get comfortable, just sit back and relax and enjoy the webinar. It will be recorded, so if you want to come back and rewatch a point that you kind of missed during it, you don't have to worry too much about taking notes. Just take in the information and give yourself a chance to kind of come up with questions that you might be dealing with your own plans that you can ask. We have a chat function which we'll use there for if you're having technical difficulties at all, as well as a Q&A. So if you have a question as we're going through the webinar, just pose that in the Q&A section there. And then I'll be looking after those throughout our session to see if there's any we can bring out at special topics, or we'll address the rest of the questions at the end if there's any additional questions. As well, we'll have some poll questions that are going to come up. So, as we go through our presentation, we'll just ask some questions out there to you to give you a chance to give us some feedback about who you are and what your concerns are, that kind of thing. And that way you can interact a little bit. So, we want to make it more like an informative session, a discussion with you, and feel free to put forward your questions. Anything that we don't get to at the end, we'll be sending out at the end of the webinar as well to make sure everyone's questions get answered. So not to delay further, I'll hand everything over to our panelists, but first we want to get to know a little bit about who you are. So just take a moment to answer this poll question that's come up. So what sector is your business part of? Are you coming from industrial, retail, real estate? Are you part of the service sector, or are you in another category? And maybe, it looks like we have a lot of other business types as well. So, I go ahead and kind of put in the Q&A, whether or not, what kind of industry you're coming from, what your business is. We'll just give that a minute to complete. So we have some people from government as well, some people from education. Yeah, so that looks like it. So we have a lot of people in other business sectors, a lot of people from the service industry. So 60% of respondents were actually in the other category. So we'd like to know a little bit more about that if you want, as we're going through, and then we can, or you can just chime in with your questions so that we can address your specific sector directly as well. 11% from real estate, 24% from services, and 7% industrial. So with that, I'll hand it over to our presenters. And we'll kick off with Algoma Public Health.
Hi there, thanks for having us. So just to get things started, I'm just going to kind of give a quick overview of some of the things that have been permitted to open with the phase 2 reopenings. Just a very quick overview, just in case people aren't aware. Now, although there are a lot of things that have been allowed to reopen, it's just important to remember that nothing is really opening in the way that it was open before. Nearly everything has very specific conditions in place to help prevent the risk of spread of COVID-19 in their workplaces. So just keeping that in mind in the back of your head. And we're going to talk about a few different precautions that can be done specifically, but for the most part, things can be applied very similar throughout different workplaces. And so we're going to talk about that. A range of things have been allowed to open, from the retail, food, and personal services. A common question we've got about personal services is if people are allowed to do work on the face, like eye waxing or face work in any way, and that is not included in personal services. It's essentially everything else but that, just to make sure that's clear for everyone. But the beauty salons and shops and hairstylists are all allowed to be reopening, including the tanning and tattooing places as well. Um, so wide range of personal services have been allowed opening. Retails have been allowed to open with specific conditions as well. So to limit people coming in and having COVID precautions there. Our restaurants were always allowed to be open with our takeout, but now they're allowed to open for the patios as well. But again, we don't want to see crowded patios in any way, so we want to make sure that those are being done safely as well. And the reason why patios, or a good reason for patios being started, is just because of that additional airflow that's allowed for outside. That's why we don't want to see places putting up very large tents. Because if we have a wedding size tent getting put up and people are sitting near the center of that area, there's not really going to be any airflow, and it kind of defeats the purpose of being outside to begin with, which is why we are pushing for umbrellas or small tents, and the number to kind of go by is 10 by 10 with regards to that for patios. Just as a quick overview, shopping mall centers are allowed opening, and that's an interesting one because they can have their own policies and procedures in place, but then typically the businesses within those have their own policies and procedures as well that are coming from their own head offices. So it's kind of a two-tiered system that is working for them to open safely. A few smaller ones that may sometimes go under the radar and people don't think of include photography and film and TV, allowing to start up, assuming that distancing can be maintained and things can be done there safely. Same goes with tour and guide services as well. Not going to get into too many specifics about that, but it's something that typically goes under the radar. People don't think about it as much. Another one that may be of interest for some of you is with regards to recreational water facilities. So pools have been stated they're allowed to reopen, but something that's important that maybe not everyone is aware of to note is that if a pool has been closed for a prolonged period of time, which at this point they have been because of the pandemic, they're all required under the Health Promotion and Protection Act. Legally, they have to notify the health unit, and they require an opening inspection before they can open. So if you're part of a hotel service or recreational facility and you have a pool that you're planning on opening, just do make sure you contact the health unit and your local health inspector to arrange for that inspection, because you cannot just open up without it. Same goes for this splash pads. We'd like to have those inspected and opened prior to working. Hot tubs and those other sort of facilities that are smaller are not permitted to be open at this time. Wave pools, I don't think we have anything like that in Algoma to worry about though. Beaches are included. They were included in some parts in stage 1, but that also comes down to the municipalities as well. So if you have confusion about that, then sometimes that might be worth talking about with your municipality. And another big common one that people have been asking about is training in gyms. So nothing indoor is allowed, but small groups for personal training are allowed to be done outside, assuming the physical distancing measures can be met. And that was a popular question in the earlier parts of the pandemic, asking when they can come up. Something to keep in mind is that we don't particularly know, we're not giving a heads up at the health unit as to when a phase is going to happen. So if anyone was planning on asking today, when will phase 3 be announced? When is a business that's not in phase 2 going to be announced to open? We don't know. And we also don't know what the specific requirements are at this time that when they are allowed to open that they'll have to meet. So we can't unfortunately predict the future. We're not privy to that information until it comes out, just like everyone else. So we can have discussions about it, but we can't give you specific recommendations at this time if anyone was going to have questions about that. And then wedding gatherings and funerals, those have been extended to 10 people. And churches are allowed to resume with limited abilities within for services. Don't need to get into the specifics of that now unless anyone has questions. That's a very general, quick and dirty overview of it, but I hope it kind of brings some people up to speed on a few of the specifics about the reopening. And then Jen, you had a few things you wanted to add?
Yeah, I'll just touch base on some of the numbers within Algoma. So if you visit our website, the numbers are updated daily as they do change. But as of this morning, when I gathered the numbers within Algoma, we've tested 9,762 people. Of those people, we had 23 positive cases, and of those, 21 are resolved. So at this point, we have 2 positive cases that are still pending resolution, which is 14 days from symptoms or testing. We've had 8,838 negative tests and pending 901 results. Now the reason we're talking a lot about precautions for businesses and that sort of thing is because we do know we have community spread in Sault Ste. Marie and Central Algoma, and likely and very probably in North Algoma as well as Elliott Lake. So pretty much confirmed community spread in all of our communities. And what community spread is we cannot confirm how this person contracted COVID-19. So they don't have an extensive international travel history. They have not been close contact with a positive case. So that's what, when you hear the word community spread, it means we don't know how they contracted it. So not statistics for Algoma, but statistics for Ontario is most people, so 65%, most people who test positive for COVID-19 they're able to track the source. Most of it is close contact with a positive case, which means a family member or someone that they've had frequent face-to-face contact with for an extended time, and within that 2 meters or 6 feet of space. So that's why we talk about physical distancing, and we'll get into that more, is because keeping that physical distance can help greatly reduce the risk of contracting COVID-19. From the evidence and research that we have through public health, COVID-19 is droplet based, which means it's bigger particles that spread the disease, and it can't travel extensive distances. So that's why we say about the 2 meters, 6 feet of space helps reduce your risk greatly, because it is spread in larger droplets, and that's where the close contact increases your risk. And we'll get into that about specific ways to reduce risk later on in the presentation.
Thanks, Jen. Dave, I think you've changed the slides. Could you pull them back up on the screen? David Muse.
I apologize for this. I'm not sure what happened here.
I think
What are you seeing, Steve?
we can sorry guys, we can just see the overall PowerPoint, but not the projection view.
Okay, then Rui, can you jump on and
While we're waiting, I will add, one of the slides was looking at the Michigan numbers. So just so you know, the border closure, except for essential workers and specific travel reasons, they've increased it to look at families reuniting. But the border has been extended to close, I believe, till July 21st. So they have confirmed the border closure. We do know that there are some hotspots in Michigan that have higher numbers too. So just something to keep in mind, especially for those who live in Sault Ste. Marie as a border community.
Thanks, Dave.
is that up there now, Steve?
Looks good now, Dave.
I'm sorry, guys. I apologize for that.
Yeah, so we're just looking at the Michigan slide now, and so we'll go on to talk about the different phases of opening, and I think Jennifer is going to continue with that topic.
Mike had kind of touched on this previously. So where we are right now is, if you look at the chart, phase 2 and stage 2 is where we're at right now. So like Mike had said, if we had a crystal ball at public health, it would be fabulous, and we could predict when things would happen and what each stage would include. Unfortunately, we don't. So we're waiting to move to stage 3. The province has said, movement could be fluid. So if we have a spike in cases, we could move back to stage 1. So we really can't predict the timeline of how things will move. And, they are potentially predicting a second wave. So again, if that happens, we could move to an earlier stage as well. So.
And before we move on, we had a question come up. Michael, maybe between you and Jennifer, this is a good one. You talked about how pools were going to be allowed to reopen following an inspection. They could reopen. Is there any guideline about what the capacity is of how many people there will be allowed at a time in the pools?
I can speak to that. So there'll have to be a capacity reduction. It's going to vary based off the size of pool, and there's not a specific number that we've been given to go off of. Like we can't say per square footage it's going to be this number of people, because different pools also have different deck sizes too. So that's another reason why the inspector should be meeting with the operator of that pool before opening. I mean, they legally have to, but that's a benefit of it as well. So that will be discussed at that time. Some of the things that can be implemented that will help with the reduction of people going in there is having people, well, if it's a Class A pool, we need a lifeguard so they can monitor and ensure physical distancing in that manner. But if it's a Class B pool, which would be like in our hotels and things like that, having people check in with the front desk or having reservations to get into the pool are some of the ideas that can be implemented to monitor who is going into the pool, and having seating around the deck area. So if there's chairs around, making sure those are all well spread out, so it will help be a visual cue and reminder to people that they shouldn't be sitting close to others and ensuring that physical distance.
Great. Now, Jennifer, was there anything more you wanted to go on about the phased reopening and the different phases themselves?
Not particularly. So there are some guidelines as the province does reopen. They are issuing some guidelines for different sectors that can help support and give them specific ideas for that sector. In this presentation, we can't delve into the specifics of each sector, but certainly there are guidelines for a wide variety of businesses out there, and some are put out preliminary. So even if the business is not able to open at this point, they can look at some of the guidelines and get some general ideas of what may be required, and start proactively thinking about what they may want to do, as well as those that are open kind of evaluating their plan as they go to put new policies or new things in place as needed.
Okay. So I think we'll go to our second polling question now. Is your business currently occupied? So right now, are you bringing people into your business? And sorry, there's a little bit of a confusion with what's displaying and what we brought up. The options are yes, we're occupied the same as we were before. Yes, but at a reduced capacity. Actually, yeah, we're going to go to the question that's corresponding to the slides here. So we'll streamline things a little bit because we don't want to go over time. Now we're going to ask you, what do you see as the biggest risk factor for COVID-19 transmission? Because that's the next thing we're going to talk about. Do you think that it's the immediate exposure to respiratory droplets that's the biggest risk, exposure to resuspension of particulate, contact with surfaces, or circulation of the virus in your HVAC system? What do you think is the biggest risk factor? So far, we've got about 65% of people saying the immediate exposure to respiratory droplets is the biggest risk factor. With a close second, around 22% at contact with surfaces. And we'll just give that another few seconds to have all the answers come in. So we have 69% of people think that it's respiratory droplets that are the biggest risk, with 22% at contact with surfaces, and just a few of our participants thinking that circulation in the HVAC system or exposure to resuspension might be more of a concern as well. So now I'll pass it back to our panelists to discuss transmission and risk factors.
Hi, everybody. Steve Booth. So I mean, the good thing about the message that, public health has been getting out there is that I think almost everyone in the group, the way we saw those risks is pretty much, I think, the way we're considering those risks, where there's really a high risk of transmission around this droplets and direct contact. So when people are in close proximity, breathing on each other, sneezing, coughing, speaking, singing, those kind of things can create respiratory droplets that can be quite concentrated in the immediate areas around the person, but tend to settle out of the air relatively quickly. So, and it's when you're in that sort of close range, you know, with those kind of activities going on, that's where the primary routes of exposure and contracting the illness has. And so since we've talked about this a couple of months ago, we've kind of revised our sort of risk level. So we had, you know, high, medium, and low risk before, and now we have high risk, low risk, and even lower risk. So on the low risk side is the secondary contact. So someone coughs or sneezes or breathes or gets droplets on a desk or on their hands and then on a doorknob. While that's certainly a possibility for transmitting the virus from one person to the next, it's a substantially lower number of cases that occur that way in comparison to the other. And that may partly be because, you know, we've all gotten very good at doing hand hygiene as well. And I guess the other thing to think about there is we've spent a lot of time, a lot of companies have spent a lot of time focusing on cleaning. And there may be some realization now that, you know, maybe you don't need to clean quite as much if you're maintaining that very good hand hygiene and not touching your face. So, you know, if there's something on a surface, you have to pick it up off the surface and then you have to get it into your body as well. And getting it on your hands alone is not enough. So that's where that hand hygiene comes in. And then, you know, on a slightly more controversial side, there's this a possibility, at least, for airborne and fecal oral transmission. So airborne is this idea that, and I should say that from a public health point of view, there's not a lot of support for the concept of airborne transmission, i.e. small droplets get carried a long distance away through a building HVAC system and then cause an infection somewhere else. There are some individual papers, some academic talks that we've attended that talk about this as a possibility, but not necessarily as something that's actually happening. And the other side on the sort of the controversy is that both ASHRAE, the American Society for Heating, Refrigeration, and Air Conditioning Engineers, and their European equivalent have both come out and said that airborne transmission through an HVAC system is likely enough that we should be taking some controls. So whether that's actually happening in the community, certainly a couple of organizations at least have said, well, there's at least enough possibility that we should be taking some fairly straightforward controls. So that's sort of the high risk transmission through that droplets and people being close together, that lower risk transmission of picking the virus up off a surface and then putting it into your eyes, nose, or mouth in some way, and then that sort of lowest risk idea of airborne transmission. And the fecal oral idea is that the European HVAC Society, in their sort of position paper on it, they speak a little bit about commercial toilets not having a lid, that there's some aerosolization of particulate when you flush a toilet. So going to the washroom can shed the virus. Flushing the toilet could potentially aerosolize that particulate, and then that could be a potential hazard. So those are really the three modes of transmission, and in order of likely risk level. And we'll move to the next slide, I guess, Dave. And I'll let you talk about risk assessment.
Thank you, Steve. Yeah, let's talk about risk assessment a little bit here. I think everybody here on this webinar is a risk assessor. We assess risks every day, each and every one of us. Stuff like, can I cross the road here, or wait till I get to the intersection? You know, do I need to bring an umbrella on my walk to work? Where should I invest my money? These are all ways that we're assessing risk. How about, should I really cheer for the Leafs? Just kidding. You should still cheer for the Leafs anyway, because there's no risk in that. Okay, the virtual booing can stop. It really comes down to weighing the risks against the benefits in the risk assessment. So we may do a lot of these throughout our day without even realizing we're doing it. It almost comes as a natural thing. But when we're looking at it from a COVID situation, we want to walk into a building or a location and assess where all the potential exposure areas in that space are. And the reason we want to determine where all those risks are is so we can put mitigating factors in to help mitigate the risk. Now, let's talk about perceived risk. What I want to talk about on this slide is communication. I think what's extremely important is clear, concise, and timely communication is essential, because knowledge empowers people. So we want to make sure that the people that are coming back into our buildings are well informed and have all the information that they need to make the proper decisions. Before COVID, and we talked about air quality. People maybe didn't want to go into a building because the air quality was bad. They might get sick. Now, with all the press that COVID has got over the world and the people that are dying and things like that, there will be that perception from people that if I go to my workplace again and I catch COVID, I could die. I know that's an extreme, but those are the people that we got to convince that it's going to be okay to come back to the buildings. So we have to, if we can convince those guys that it's okay to come back, then the rest will probably be okay with coming back as well. So some of the things, the tools that we have to use to make that happen is we need to listen and to respond to the concerns of tenants and employees. You know, there's social media, there's all kinds of ways that they can get concerns and questions to you. So we got to make sure that those avenues to get the concerns to us are open. We need to be honest and transparent, even when the news is bad. You know, we all love sharing good news with people, but let's be honest and open with the bad news as well, so everybody has all the information. If we do any kind of auditing in a building, you know, we're already required by provincial governments to make sure that people have all this information if we're going to do an air quality study or we're do something in a building. So let's make sure that we get all that information out to people, and timely is important, because trust, I'll go back to the word trust. Once you lose the trust in your workforce, it's very, very hard to get back. So let's not go down that rabbit hole to start with. In our company, Pinchin, we got a business continuity team that I don't think they're meeting daily anymore, but for the first 8 to 10 weeks of the pandemic, they were meeting on a daily basis, including weekends. And our president was sending out updates on what the company was doing to respond to the pandemic. And we were getting updates from them on a daily basis. So everybody in the company was well informed. So the communication piece is an extremely important piece, and something that we should put a plan in place when we're coming back to work. I want to talk just a little bit about this hierarchy of management controls. We've seen, most of us have seen this triangle before when we talk about engineering controls and administrative controls and PPE. and how PPE is the less effective. With COVID, we added a top layer, a physical distancing layer. It's the most effective control that we have to protect ourselves from COVID. So we're going to talk a little bit in some slides later about maybe some engineering and some administrative controls. But the moral of the story is, if we can continue to distance and physically distance ourselves, that is the best control that we can. That's the easiest way we're going to prevent the spread of this disease or this virus. Yeah.
Did you have more to say
No,
on that?
I think that's that. I had a thought there, it just popped away. That's fine.
No worries. I'll ask Algoma Public Health as well if they have anything else to add in on that topic of the hierarchy of risk management. And also, we had another question about transmission, in the context of our, going forward in our conversation of, can you get transmission of the virus through an open sore, for example, like contact with broken skin, say, even if, you have hangnails or something of that nature. I'll leave that to you guys to answer, and then Algoma Public Health, Jennifer or Michael, if you wanted to say a little bit more about risk management as a whole.
So I'll touch on, transmission through open sores. From my understanding, and don't quote me, evidence is lacking. It's more through the droplets, so moving in through the mouth. So the hand to mouth, hand to face, as was talked about before, is the source of the risk of transmission from different items. And like they were saying, it's not the touching of items that's the risk, it's touching of items and then bringing the hand to the face, which is where the hand hygiene and washing hands, hand sanitizing comes in. I just wanted to reiterate the piece about communication with employees, and that is an exceptionally important aspect of this. In dealing with this for months in public health, we know that there's a spectrum of how people react to this virus, with some people, not taking any precautions and not having any fears, and others on the other end who do have a lot of anxieties and fears about it for personal reasons, social media, whatever reasons. So communication is key for businesses, employers, and managers. When it comes to the hierarchy of risk management and controls, I like to simplify it. I mean, there's specifics that you can think about, but three kind of key things. Physical distancing is number one, like we talked about, 6 feet, 2 meters of space. Number two, hand hygiene. Wash your hands, wash your hands, wash your hands. You can't wash your hands, use hand sanitizer. And number three, and important for businesses, especially with employees, stay home when you're sick. If you're sick, don't go out, stay home, don't go to work. So to kind of simplify it, those are the three kind of main things that will help prevent the spread and help get us through this. And also important messages, whether COVID-19 is happening or not. So for physical distancing, some key things to think about for the workplace. If people are at desks, separate desks. Make sure you have that 6 feet or 2 meters. Work from home options, keeping those in place, for the foreseeable future. We don't know how long we're going to be in this, so if you have the ability to do work from home, virtual meetings, another important consideration. Also looking at staggered start times, break times, that sort of thing, so you don't have people congregating in the lunchroom or various areas all at once. Engineering controls, so you've seen like plexiglass barriers at some businesses, but really any sort of barriers. It does not need to be super expensive, but plastic shields, that sort of thing can help prevent. Hand washing stations, having hand sanitizer available, and making sure the hand sanitizer is approved by Health Canada. And depending on the workplace, there are some certain requirements for what type of hand sanitizer is used and what alcohol level. So just be mindful of that. Tissues and lined garbage cans are also important, as well as signage. So I think it was talked about before, visual cues. So signage, reminding people about physical distancing. If you have customers in the area, signs on the floor telling them how far apart to be spaced. Signage asking people who are ill not to enter the place of business, those sorts of things. Policies, so administrative controls, looking at policies, so work from home policies, sick policies, not requiring a medical note is one thing that is key during all of this. And another key thing that's kind of come up is if you're having employees enter various areas or having customers come in, keeping a tracking list of who is entering that business. So having their name, some sort of contact information, as well as the date and time that they were there. This helps public health in case you do have a positive case that was at your business or through an employee. It helps us do our contact tracing and contact people if there's a potential that they could have been in close contact with this person. At the very bottom is the less effective modes of prevention, which is the PPE. And you probably wondered, it's in the news lots lately about masks. So you probably wondered why we haven't mentioned that as of yet. And it's because it's kind of the last resort. Physical distancing is the key way. So that's 6 feet, 2 meters. If you as an individual or an employee, if there's a potential that you can't keep that distance, what is currently recommended by public health is to wear a cloth-based or homemade mask. That being said, you have to make sure that you're wearing it properly over the nose and over the mouth. You're not touching your face while you have it on. You have to keep your hands away from your face. Making sure you wash your hands before you put it on, as well as before you take it off and after you take it off. At the end, we will share some resources. So we will share our health unit website where there are some videos as well as further information and details about mask wearing.
Thanks a lot for that, Jennifer. So now I'm going to pass it over to Stephen again, and we'll talk more about some different risk assessment issues in different sectors real briefly, and then we'll go into more of like the practical points on the risk management. And we can get a question too as well when you get, Stephen and David, when you get to the points about our controls that we implement, talking about the multi-barrier approach of, having multiple layers of protection rather than relying on one method.
Yeah, so why don't I, maybe I'll just start there really quickly and say, I think that's absolutely correct. So this idea that, you're not just going to rely on one thing, but you're going to put together, a series of controls, and those series of controls will work together to help reduce the risk associated with transmitting this virus from one person to the next. I don't know that we're ever going to eliminate that risk. So this is all about risk reduction. And it's between the physical distancing, between the cleaning, between the hand hygiene, between all the other controls, we can get to an area where the risk for each person going into the office is acceptably low. So these next few slides, really our goal here was to think about, we've gone into our places of business for years and years and years, and we've done our jobs. And now each one of those tasks and elements of our work really takes on a new dimension. And that dimension is, how, while I'm doing that, might, is it a risk of transmitting the disease, or is it not a risk of transmitting disease? So, what we've seen in the industrial, forestry, mining sectors are issues around, fly-in camps with shared accommodation, with difficulty getting someone out, should they become ill on site. And, it's just as simple as things, transportation to and from. So at our work in Labrador City, they've built, a relatively complicated procedure with a plexiglass barrier for the passenger side of the truck, and then the driver takes the person around so that there's, separation at those at those areas. There are certainly tasks that just require two people, and they require two people to be close together. So if you're lifting a heavy object into place or you're moving things, those, we need to be thinking about what those tasks are in our work environment, and then we need to understand what the risk is around that, and then develop a control measure that makes it that reduces the risk and makes it as safe as possible to get that done. The other issue we've seen fairly significantly, particularly in some industrial sites, are sharing of safety gear, sharing of tools, sharing of forklifts. So passing one forklift from one shift onto another shift, headset use, going from one crew to another crew. So how are those things getting cleaned and disinfected before the next crew comes in and takes over? So those are just some areas to consider. Dave, you want to switch to the next slide? Dave, can we move to the next slide? There we go. So, the next thing we were thinking about is sort of tourism, and that really runs the gamut from, small tourist attraction museums through to restaurants, through to, fishing tours, those kinds of things. We have to consider what travel restrictions are in place. When we look at restaurants that, phase 2's allowed patio only seating, but, what do we do when people are back inside? How far do they have to be? How do we handle shared cutlery? How do we handle, there's just a myriad of things on the restaurant side. The vacancy period in rooms. So what do we do when one guest leaves before another guest comes in? So that transition point is an issue that needs to be looked at from the risk management point of view. When you're doing some kind of a tour, and previously you had a tour boat, and there were 25 people on a tour boat going somewhere, like how do you make, what changes do you have to make to that process to make that safe? Dave, we can move to the next slide. So very commonly on the commercial office settings, some of the real risk and pinch points are around reception areas, particularly around elevators. How do you possibly maintain physical distancing in an elevator? And in taller buildings, restricting elevator use to only one person basically makes the upper floors of the building mostly inoperable. That might not be the case in a small 3-story building, but if you're getting into a 20-story building, that's certainly possible. How are we handling hoteling stations? How are we handling washrooms? And that's really across the gamut. What's the cleaning protocol like? How many people do we allow in? Those kind of questions are all questions we need to be asking. How do we handle delivery of packaging that's coming in? And how do we deal with the constant meetings that go on, that make a workplace, the place you go to? You don't go to meeting just to sit at a desk and do work. You usually go to communicate with other people and to collaborate and to work together. So how do we redesign all of that with COVID-19 in mind? And we'll switch to the next slide there, Dave. I think is the retail side of things. So thinking about retail, like how many people are you going to be allowing in your store? What's the layout of that retail space going to be? How can you maintain physical distancing while people circulate through the building? What are those common touch points in the store? The front door, the cash machine, all those, the countertop, those kinds of things. How do we control for those? What kind of payment measures might you put in place? How are we going to handle public washrooms? And how are we going to make that interaction between the cashier and the person buying the object, how are we going to make that as safe as possible? So those really fall under, the idea is these are the kinds of things that we used to take for granted, and now each one of them present a potential risk for exposure to the SARS-CoV-2 virus that's responsible for COVID-19, and we have to have some control measures in place for many of these things. Next slide, Dave.
So now let's just jump into one of the risk management tools that we use in elimination. Elimination is an important one. Elimination, if you look at the hierarchy of controls, the elimination, it would be part of an administrative control. So the best thing that we can do is try to eliminate at the source whatever the contaminant is. In this case, it's COVID. So to try to eliminate it at the source, we do self-screening, or we put signs. We train people how to self-screen. So if people know what to expect as far as symptoms go, they know how they should react to symptoms. They may very well self-screen enough and stay away from work. Even with that though, we won't catch everybody, because there's those asymptomatic people out there. So we can never eliminate the risk totally by self-screening or by screening, but we can reduce the risk for sure. The other piece with elimination is eliminate things that we touch. Like, leave doors open, take doors off so the doors don't close. Take the communal coffee machine out of the coffee room, although you might get in trouble if you do that, but take the microwave out. So we can eliminate sources in that respect too. I don't know, I'm sure that you guys, we don't have much time now. We're gonna ask you guys to drop in the chat other activities that could be, or things that could be removed to help out here. But I just wanted to get you thinking of the many different ways that we can eliminate the potential for exposure. Back to you, Steve.
Thanks, Dave. Let's think about sort of risk management of that highest risk, that sort of contact risk, and how we maintain physical distancing. So we've actually considered the idea of face coverings as a physical distancing measure and not a personal protective measure, because in our mind, you're not, the face piece is not filtering out contaminants that are coming from someone else. They're actually acting as a very localized barrier to your speaking, sneezing, and coughing that's emitting particles. So it's almost the same as having a poly barrier between one workstation and another, except that you're wearing it on your face, so that you're not projecting those particles out around you. So that's something that certainly when you can't maintain the physical distancing, the face covering is certainly something we should be looking at. Should also be thinking about barriers. So in that same way, if we have a certain process where people have to be close together, but we could just put a barrier between them, that can implement sort of an artificial physical distancing. And we think about the labs at the Pynchon office. Each one of these cubicle workstations is closer than 6 feet. So we've erected polyethylene barriers around and between each one of the lab techs so that they can still go in and do their work during the day. We're looking at reducing occupancy levels, and what we've seen from most of our clients across Canada is anywhere between 20 and maybe at the most 50% back in the office. And we've done a really good job over the last 20 years of packing people into office space, and now now we're looking at really reducing those numbers. Studying and understanding the traffic patterns, so having one-way routes of flow so people aren't walking by each other in a corridor. That can help. Having lots of signage and lots of training so that everyone knows what they're supposed to do. We can't expect people to follow these rules if they don't know what the rules are. Working out some elevator logistics, maybe working out spaced seating in a restaurant area once we're allowed to be back inside, and certainly installing some barriers at sales counters. So these are all ways that we can help maintain physical distancing and reduce that high-risk spread of droplets and close personal contact. So go to the next slide, Dave.
So just quickly here, talk about managing risks. I know, Jennifer, you already talked about the personal hygiene piece, and we've been bombarded from day one of the pandemic with, wash your hands, don't touch your face, wash your hands for 20 seconds. This is not only great advice, but it's great advice that we should follow for the rest of our lives, really. Good stuff there. The cleaning piece, there's two different types of cleaning that we believe are out there. It's a proactive and versus incident cleaning. Proactive is you don't have any cases of COVID in your space, you just want to be proactively cleaning it. And obviously the incident would be if there was a positive test for COVID in your work. So both of those have to be treated a little differently. And in the second incident, developing a scope of work is extremely important. Knowing where the person who contracted COVID worked and what they did in their daily routines to help with the cleaning. The frequency of cleaning, that's going to be determined by the number of people in your space, how big it is, the different touch points, the frequency of different, you might wash your bathroom more often than you wash or clean other areas of your building. There is a technical skill level that's involved in this cleaning. And where that skill level comes out, we're using disinfectants, and the disinfectants that we're using are just incidentally, if you're looking for them, and I think we all know this by now, but Health Canada has a website, and on their website they have a list of disinfectants that we should be using for this, and disinfectants that are proven to kill the virus. So we should be using something off that to start with. But there's also ways that we use these disinfectants, i.e. the amount of time the disinfectant is on a surface is incredibly important. So if that's not being done properly, it has to remain wet for the entire time. It has to be mixed properly. So there's a little bit more science to it than just washing something down. And then the last piece, there's various ways to verify whether or not a surface is clean, and we don't have time to get into them all right now, but suffice to say that there is surface testing that can be done, not necessarily to say whether or not there's COVID or not on your surface, but to determine whether or not it is clean. So, and we'll move to the next slide to you, Steve. Take your mute off, Steve.
Right. A lot of evidence that HVAC is a significant means of transmission. Lots of building and property management owners and companies are making some modifications to their HVAC system based on the recommendations made by ASHRAE. So the things that ASHRAE are looking at to help control that are, let's say that if you don't even have HVAC systems, one of the first recommendations is, just provide more ventilation by, keeping the outdoor door open, keeping the windows open, promoting air circulation that way, even where no ventilation system exists. When you have HVAC, flushing the building, so running the HVAC before and after the workday is completed to sort of change out the air in the space, to bring in more outdoor air than you would normally. And ASHRAE recommends 100% outdoor air where that's possible. That's not always going to be possible, and maintain a comfortable work environment from a thermal point of view. So, on a really hot, humid summer day, 100% ventilation isn't going to work, but certainly spring and fall, that's a good idea. They're recommending improving your filtration. So where possible, moving to a MERV 13 filter, where that fits in the unit, where that makes sense. And just look where you can upgrade the filter, inspecting the filters, making sure they're seated properly, those kind of things can help improve overall filtration. Running the systems for a longer period of time, maintaining relative humidity within a 30 to 60% range, and maintaining that washroom exhaust ventilation so that we're ideally keeping those spaces under negative pressure compared to the rest of the space, and then potentially doing some indoor air quality monitoring. So how can we verify that these HVAC systems are functioning the way we want? Well, we can do testing. So we can look at carbon dioxide to look at ventilation rates, we can measure relative humidity, and we can look at airborne particulate as a measure of the filtration efficacy. And then now those ideas can then feed back into the communication cycle, so you can let people know that you're maintaining the building in such a way to help control the risk to the extent possible. So go to the next slide, Dave, and I think we have a last slide for Algoma Health. Oh, no, we have another poll. So I guess the poll question to ask here is, do we think COVID will be a greater or lesser concern in 6 months' time? Yes, it will be a greater concern, or no, it won't be a greater concern, or no, there's 3 answers. There you go.
We'll give that a couple seconds for the answers to come in, and we see that most of you are still with us. We're going a little bit over time, but we're going to wrap up now. We're going to talk about some resources that we have to lead off. And so now it looks like we have 38 votes. And we have most people saying that well, it's pretty even actually, between about the same. 45% of people think that in 6 months' time, we're going to be sitting in a pretty similar position. 39% of people thinking lesser, and 16% thinking greater. So, you know, it's hard to tell what the future holds, whether we're going to be in the middle of another upswing in 6 months' time, if things are going to be a little bit better, or if we're going to be in a bit of a holding pattern. So we'll wrap up with some resources to leave you with, but also, Stephen, maybe before we finish up, we did have another question come from Ashley, one of our local business owners in Sault Ste. Marie, and she runs a cafe and is wondering about, you know, whether how much importance there would be on installing a plastic guard in the cafe counter. You know, there could be some logistical issues with getting the items to the customers with a barrier in place, but how much value does that add, you know, in terms of trying to find workarounds for if it's a sneeze guard style, or you know, it's also a retail store, so making kind of any kind of accommodation for that.
Yeah, well, and I mean, the problem is that sales transaction between the customer and the clerk is one that is very difficult to manage and maintain social distancing, physical distancing. So, you know, we have to have some kind of control in there. And you may not want to ask customers to come in wearing face coverings. So, you know, one of the kind of the easier solutions is to erect some kind of a guard between the cashier and the customer at that point in time. I mean, we've seen just locally here, one of the small butcher shops in our area has, you know, one that was made out of it was essentially a cardboard stand with a plexi sheet in the center, and they fold it together themselves and put it on the counter. It was a relatively low cost solution. And then with respect to handing items, they just simply hand the goods around the barrier, right? So I don't think it has to be terribly complicated. And you could think about, you know, maybe a face shield, and, you know, might provide some protection for the worker as well. So, I mean, I think there are lots of ways to approach it, and you have to figure out what's going to work best for your specific business.
And Jennifer or Michael, do you either of you have you know, anything else to add in that?
Yeah. So I think it depends on the business, because I know some of the restaurants I inspect, they have large counters. So if you can maintain that physical distancing, if you can have that 6-foot gap between you and the customer, and you can set the food that they've come in for takeout there for them, and your staff can maintain their distance comfortably, then you're in the clear. And otherwise, you can do some of these things that were just mentioned for putting up a barrier, a physical barrier, if that distance is not maintainable. Another thing too, just to keep in mind, we just want to remind people that the face shields don't replace by any means the face masks, the cloth masks, because the masks are what are going to prevent your droplet spread and do more protection from the droplet spread. The shield will give some additional protection, but it is not a replacement by any means. If you're wearing a shield, that would be in addition to a mask.
Great. Just to mention also to all of our attendees, if you do pop a quick question in the Q&A box, even if we don't have time to talk about all the questions as we wrap up. All of those will get answered and sent out following the webinar. So that's really good. You know, if you have a question you just want to pop in there, and even if we don't get to it, you know, we will address all of those following the webinar. And I'll hand it back to Jennifer to close off with some resources.
Yeah, so on this slide, there's a few resources and some links, but I just wanted to let everyone know that Public Health has a dedicated phone line as well as email that's staffed by public health inspectors as well as registered nurses, public health nurses, to help answer questions for employers or community organizations, groups, that sort of thing. We do have some videos on our website, as well as if you follow our Facebook account, we try and share a lot of information and recommendations that way, both for individuals, community members, but also relevant for businesses as well. And just prior to this, I think Tuesday, a couple of days ago, the province did release a guide. It's the first link up on the top there, about workplaces. It says safety plan, but it's more kind of a general policy plan, things that you can put in place as an employer to help keep your customers and your employees safe.
Thanks for that, Jennifer. We'll go on to close off. We had another question that had come in on the topic of specific sectors and resources opening. So maybe this is one for Algoma Public Health, but one of our attendees was wondering about ice rinks, whether those would be allowed to open, you know, even during the summertime. Sometimes those are used for other activities.
At this point, we don't know how things will progress and how the announcements will look. It's all based on the government announcements as well, then followed by legislative changes. So I wish we could predict, but at present time, we don't know when that will be allowed, if it will be allowed, how it will look. As a number of the presenters have said, like, things are reopening, but they're not looking like how they were before. So we don't have that information at present time.
Okay, and we also have a question for our panelists in a specific environment. Teresa is asking about, you know, she's in a manufacturing environment that gets very hot. So that's a special concern from them, and they're looking at heat stress as a concern. So, you know, in that scenario, masks aren't ideal because they contribute to the, you know, what people are experiencing from heat. So do you have any suggestions? You know, there's strategies you can use in your heat stress management as well to reduce the actual heat people are experiencing, and, you know, but then of course masks are going to contribute to that. So do you have any specific advice to add in that scenario?
Okay, I'll let Jennifer answer.
Well, you might have more specifics than I do, but I guess I'm kind of just going back and reinforcing the physical distancing message. We do know masks aren't an option for some people. Heat can be a barrier, but also children under 2 can't wear masks, as well as people with medical issues, primarily severe asthma or COPD, which is a breathing issue. So that's why we, you know, defer back to the physical distancing. And I do believe that's why, you know, the province and Canada as a country has not come out and said masks are mandatory all over in public, recognizing that it's not feasible for all in all situations.
Yeah, that's really a good answer to that. And then also, I mean, you know, it kind of loops back to what we talked about, our multi-barrier approach. And, you know, in an occupational setting, you also have to consider, you know, like Jennifer was saying, those issues of physical fitness to even wear a mask and having complications from medical conditions. So you want to make sure that when you have your health and safety program in place, that you have accommodations for people that would have those medical conditions. So you know, you would want to make sure you have enough controls in place, you know, with your physical distancing and other maybe engineering measures to limit the risk of transmission, you know, so that you're reducing that risk in ways other than masks. And maybe, you know, for people that it would be too hot to wear a mask, you know, you use a couple other barrier methods or other engineering controls to make sure that you're reducing your risk as much as you can. I think we had one more question come in. That's it for our questions in our Q&A box. If you do have any other questions, you can always get in touch with us at Pinchin. You know, you'll get an email back following the webinar to follow up. And we're here to help with Algoma Public Health as well. So thanks to everyone for attending and for sticking around. A lot of you, you know, it's lunchtime and you have other obligations, but a lot of you stuck around. So thanks a lot for your participation.